Hello, this is Dr. Robert Pendergrast with a message on breast cancer prevention, especially for my teenage audience, my youngest viewers. But this information is good for women of any age, so please listen in regardless. I'm a pediatrician on the faculty of Georgia Health Sciences University and the author of the book, Breast Cancer: Reduce Your Risk with Foods You Love. You may be wondering why a pediatrician wrote a book about preventing breast cancer. After all, kids don't get breast cancer, do they? You're right. Breast cancer almost never happens in teenagers. In fact, it's more common in women who are quite a bit older. But your teenage years are one of the best opportunities you'll ever have for preventing breast cancer for your entire life. That's right. The choices you make now, how you treat your body, makes a big difference for the rest of your life. The foods you choose to eat, how often you get physical activity, how well you control your body weight are all important for breast cancer prevention. So what do we mean by breast cancer prevention anyway? Is it possible to be completely sure that you'll never get this disease? To answer that question, I want you to think back about another disease prevention strategy that you all know about. That's the shots that you received at your doctor's office when you were a baby. Why do babies get all those shots? To prevent dangerous diseases like whooping cough, meningitis, measles, and tetanus. Do the vaccines work perfectly? No, not 100% of the time. Even a child who has received all the required shots still has a small chance of getting sick, but children who get all the shots are way less likely to get sick than those who did not. And if you get through childhood without getting those diseases, we can say that you have prevented them by getting the shots. The same is true with cancer prevention. If you practice the cancer prevention strategies that I'm going to tell you about, there's still a chance that you could get cancer, but your chances are way less than someone who did not practice prevention. And if you get through life without getting breast cancer, having practiced those preventive strategies, we can say that you actually prevented breast cancer by eating and living in cancer-preventing ways. So let's talk about those strategies right now, since by now you must be wondering what they are. I'm going to break it down into 5 simple categories: body weight, physical activity, breastfeeding, alcohol and other toxins, and food choices. What about body weight and breast cancer? That makes a big difference because being overweight puts a woman at higher risk of breast cancer, especially the kind of breast cancer which occurs after menopause, when a woman is usually over 50 years old. So while the added risk of being heavy does not lead to cancer for many years, we know that it's much harder to get rid of extra pounds than to keep them off in the first place. And being overweight when you're a kid makes it very likely that you'll be overweight as an adult. If you've been working to reduce extra body weight but having trouble, ask your doctor for help. And if you're normal weight now, make a point to stay that way by limiting sugary sweet drinks and staying active. What about physical activity? Scientific studies are very clear that regular exercise at all ages makes breast cancer less likely. Even for women who have already had a breast cancer diagnosis, regular exercise gives them a better outcome from the disease. Part of the reason that exercise helps prevent cancer is that it makes normal body weight more likely. But physical activity reduces cancer risk regardless of body weight. So find something fun to do and get moving. As a pediatrician, I'm also happy to be able to tell you that breastfeeding a baby makes a mother's breast cancer less likely. When you're finished with school and ready to have a family, make a commitment to breastfeed your babies. It is the best food for a baby, makes a big difference for the baby's health for many years, helps women lose that extra weight that they gained during pregnancy, and will definitely make your chances of breast cancer less likely. And it's free. It's hard to think of anything that's free with the amount of health benefits that breastfeeding provides, and adding cancer prevention to that list makes it a powerful choice. Did you know that cancer often starts when the body is exposed to a chemical or a toxic substance? That may not surprise you, but it may surprise you that some of those toxins are already present in your home and in fact are being consumed regularly by people that you know. The first one on that list is alcohol. Of course, you know that drinking alcohol to the point of addiction or abuse is dangerous, but you may not know that even moderate drinking of alcohol increases a woman's risk of breast cancer. While there is very little harm in occasional drinking in moderation, I encourage women to average even less than 1 drink a day to reduce breast cancer risk. My final tool for preventing breast cancer, of course, it's the foods that you choose to eat. I'm guessing that you would not be surprised to learn that eating a variety of fresh fruits and vegetables is a very important part of breast cancer prevention, especially the group of vegetables represented by broccoli, cabbage, and collard greens, and dark fruits and berries like blueberries and strawberries. Get to know and love fish like salmon and sardines. Begin adding some whole soy foods into your diet every week about the time of puberty, when the body starts developing breast tissue. This is a powerful prevention strategy, so think outside the box and try some new foods such as soy milk, tofu, edamame. Those are those nice little green soybeans that you get with sushi sometimes. Also, the next time you're in the grocery, pick up a box of green tea bags and brew up some green tea for a hot or cold drink at home. While there's so much more to say about food that you would find in my book, that short introduction will go a long way for you. There you have it, a pretty simple list. But is it worth it? Maybe it sounds different from the way you and your family live. If it sounds too big to do it all at once, remember, you can start small. Just make one change now, then make another change later, and get a friend, a sister, or your mother to make some changes along with you so you have some support. You also may be happy to discover that living and eating this way gives you more energy, a better mood, and you'll just feel better all over. And how much of a difference can this make? This last number may really surprise you. The evidence for this approach is so strong that we believe that over 73,000 cases of breast cancer in the United States alone could be prevented if all women put these principles into place. Make a decision now that you're going to do everything in your power to be in that group of women who might have heard the bad news of a cancer diagnosis but didn't, because they put these prevention principles into practice. One person at a time, you can make a really big difference for a whole generation of women, and that's really good news.